Hello, everyone. Welcome to this new session of our podcast, which was created specifically to raise awareness regarding the topics of poverty and inequality. Today, we are going to focus on a problem that is continuously happening in not only one of the main world powers, but also in the entire world.
So we'll start by speaking about the access to good healthcare quality in the United States, because even though it is one of the richest countries, the quality of healthcare provided for minorities and persons in need of medical attention is not always the best, nor the most accessible.
It is no secret for most of us that the healthcare system in the United States is highly recognized and criticized both internationally and even by their own citizens for its controversial way of working.
Yes, I've heard that the United States has had many criticisms over the different governments, over the different policies that have been implemented to help its citizens, but have increased its controversy due to racial distinction or discrimination towards minorities.
Exactly. It is no surprise that the United States presents many cases of discrimination, not only when it comes to the medical area, but overall it is a country filled with inequality and a lack of opportunities or attention towards minorities. However, we will explain further how these issues can be perceived in Mississippi, which is our main focus.
To continue the discussion, it is important to say that while we were performing our research, we found a common trend in the state of Mississippi, which was quite concerning regarding the healthcare access for its citizens. As the last few years, it has always been among the last places of the national ranking made by the Commonwealth Fund.
And the worst part is that this issue aggravates even more when it comes to the Black community, especially those that live in the rural areas, which sadly represents a high portion of the African American population in the state.
It's shocking to see that this type of prejudice still happens after many strikes and protests that have been made precisely to resolve these issues, especially when talking about their own citizens' well-being and health.
Absolutely. And not only that, but it is also the cause of many deaths, which could be easily prevented if there was an adequate healthcare system provided for their population. In Mississippi, 21% of African Americans still could not have any insurance or access to a healthcare system, in comparison to just 16% of the white people in the state. This is a clear example of how unfair the system is, even in a state of low affordability, and ranked one of the worst health systems in the country.
This is a huge deal, taking into consideration that one-third of Mississippi's population are African Americans, meaning that more than half of the African American population does not have an insurance. Yes, and we could also take as an example the state of Wisconsin, which although was placed as top 21 on the same healthcare ranking presented by the Commonwealth Fund in 2023, they also presented a profound racial inequity between white and other racial and ethnic communities. Not only that, as it was reported in another scorecard made by the same institution in the same year, the health system performance scores of the white communities in this state were not only higher than the median score, but as well a little more than 5 times the score for African Americans and 3 times for the Latin Hispanics.
Of course, that scorecard also showed that it is a common trend for most of the 50 states that the white communities present a higher accessibility to quality healthcare or a lower preventable mortality rates than the Hispanics, Blacks, Asians, and Pacific Islander populations.
Now, going deeper into the political background, studies have shown that the state of Mississippi remains the most conservative all around the United States.
Yeah, and I want to add something right there with 53% of this population identifying with this political party. So, in comparison, liberal states such as the District of Columbia and Massachusetts are under the 50% of people who joined the Conservative Party.
Exactly. This is why we could say that conservatives, in this case, the ones with the higher percentage that represent them in the country, which are located in Mississippi, display that racism is still a recurrent issue that is seen in the country and in one of the many areas, or I would dare to say that the most important one, which is the health system. So, wrapping it up, this is evidently such a concerning situation since healthcare is the human paramount and essential for everybody's well-being and vitality, but in the United States, it clearly is not.
No, and let's also take into account that the US is one of the most developed countries that claims to invest millions of dollars in healthcare. However, we can also evidence that in states such as Mississippi, the health cost rates increase, making it less accessible for the whole population. So even if they are trying to improve the quality of the system, in reality, with this strategy, They are witnessing the contrary effects on their services, and at the same time, they are promoting racial inequality.
For that same reason, it is crucial that this issue is taken as a top priority by the authorities so that they implement new policies and take action to dismantle the systematic racism and work towards health equity for their citizens.
As all they are doing is lowering their population, creating problems and affecting their country socially, politically, and economically speaking. This is also affecting relations the US has with other countries, as the way they handle medical attention is not in the way expected. Personally, we think it's a need to implement legal national and international parameters to be able to take care of citizens properly worldwide. And this could only happen if there is an international cooperation.
It is crucial to take this issue into consideration, knowing that we have to take care of all citizens equally, without regarding their race or ethnicity, nor their economical income. Help us raise awareness to be able to improve the system and give citizens the proper help they need.
That's everything for today's podcast. Thank you for joining in, and we encourage you to join us to make a change and help all those who do not have an access to a good quality medical attention. We hope that this issue hopefully comes to a resolution, and we hope you join in next time. Thank you.